We have now launched the online Shockwave course. When I set the company up, which is over 12 years ago now, which is hard to believe, I was always about educating the clinicians as well, not just in terms of the technology. So when Dom Smith came to me with this idea of doing the Shockwave course, I was all for it. And Dom and Katie have done a fantastic job of putting it together. It's really impressive, really comprehensive. It is technology agnostic, so whatever system you're using will be able to help you with this. So it's a brilliant piece of work. The guys have done really well. So check it out and go to the link below and let us know what you think. Hello and welcome. Today I am joined by Dr. Alberto Scavone, who is a sports medicine physician at the Isokinetic Medical Group. Alberto, how are you doing?
Very good. Thank you, Andy. How are you?
I'm doing very well, thank you. Doing very well, thank you. So I do like the artwork in the back there. Is that you bring in some Italian culture to the UK there?
Yeah. I'm trying. There are maybe too many Italians in London, so you don't need that.
So yeah, I'm looking forward to hearing more about you and how you've ended up where you are. So where are you from originally?
I'm from a small city in the region. The name is Emilia-Romagna, so the same, close to Bologna, but on the Adriatic Sea. So I studied in Bologna, so center north of Italy, University of Medicine. After 6 years, I decided to become a sport medicine physician. And Isokinetic actually is like the main clinic, the first clinic. It's from Bologna. So I did actually my thesis with Isokinetic in Bologna in 2014. So yeah, in Bologna, and this is where I decided really to become a sport medicine physician. But yeah, the question was like where I come from. It's from a small city on the Adriatic Sea,
right,
in Italy.
Yeah, and so what made you want to go into medicine in general?
Good question. This one, like, very deep question. Actually, I remember when I was a child, I still had this draw with me with a stethoscope, talking with like this teacher. I was 3 years old or 4. So I think I don't really know why I decided to do that. But I know that since I was 3 years old, I already knew that I wanted to become a doctor. The why was like I wrote down, so I have still the draw and this thing. I was like curious to understand the diseases and how to treat them. So I think the medicine, it's like one of my best professors used to say, and that it's like to be like a Sherlock Holmes. You need to, answer the right questions. You have to understand where to search, and then you use machines or technologies to have at the end the diagnosis and as a consequence the treatment. So I think it's an interesting job to find the solution and then try to sort it out, the right treatment. So this is why I think, because I was maybe curiosity, I would say.
Yeah, and is that the same reason as to why sports medicine then?
That's another reason. When I was a child, I wanted to become an athlete, actually more a basketball player. Then because basketball in Italy is like football, the first sport, second is basketball. Then the others, they grew up. I didn't, so I'm still like 1 meter and 70 centimeters, so not enough to play basketball. And so when I grew up, I've had always this passion about sports, and as a job, the doctors, especially in the hospitals, they have to stay in a very, very particular environment, and instead, sport medicine doctors, they can just they just can trick the system. They can just work in different places that could be just like the consultancy rooms or the on the pitch. And the best feeling for me is when I am on the pitch with the players, or could be on the court with the players, or an athlete, to assist, to permit them to perform, or to return to sport, or return to perform. So this is why I decided to become like a sport medicine doctor, because I wanted to become like an athlete. I couldn't because of my I'm too nervous, and I cannot be an athlete, and also for my my fitness, blah blah blah. But I love that feeling all around the sports, the feeling that I can feel through the sport. So through the athletes, I can feel like I'm the athlete. Let's say it's not
Yeah.
like this, but I think many of us we work around this area for the same reason, more or less.
Yeah. So who was your favorite? Who was your inspiration from basketball?
I was born in 1991, so for my generation, it's always like Michael Jordan is the inspiration. In fact, like most of like the people around the even if in Italian basketball is quite a big thing, we grew up with watching NBA, so the American basketball, and at the time, we used to love, no, we still love Michael Jordan, and then Kobe Bryant, also because Kobe Bryant was born, not was born, but he lived for a long time in Italy, actually in a city close to Bologna, so Reggio Emilia, the name. So the second one would have been like Kobe Bryant.
Oh, right. When did he live in Italy then? I didn't know he lived in Italy.
It was like 7 to 10 or 11, because his father was playing for the basketball team, Reggiana, the Reggio Emilia. So in fact, he used to speak Italian, and you can find some interviews of him. Like he said, like when he wanted to offend some people on the court, he used to talk in Italian to so that he couldn't be like kicked out from the court. Yeah, in fact, he was like a fan of Milan Football Club, AC Milan, because when you are from Italy, even if you love basketball, at the end, you still watch football, and you have like a team. At least if you are like a boy, especially in like 80s or 90s.
Yeah, no, Milan. Yeah, that Milan team was amazing in those times of Baresi, Maldini, and
Yeah.
all those guys. George Weah. You used to love all that stuff. Yeah, I mean, while we touched on Milan, then, so I think like Milan are famous for that Milan lab is something that's quite internationally recognised, and so is that something within Italy that is revered and known of as being good? Like, is it genuine, or is it a marketing thing that they've got these great systems?
One of our colleagues, Dr. Boldrini, is like he works for Isokinetic and the Milan lab. If I'm not wrong, is one of the managers of the Milan lab. I think it's something that also Sassuolo Football Club did something similar with the MAPEI center, but it's more about studying like biomechanics, sport science, research. It's something that unique, I would say, in Italy. what they do there. And they have a lot of connections with the University of Milan. And so it's not just the center, it's work with like other stakeholders outside the Milan Lab Center, especially university professors. They are focusing a lot on biomechanics and performance more than, you know, the part of like pure sport medicine for doctors. I mean, so maybe around like the diagnostic part, the interventional part. But yeah, that also even Inter Football Club, they don't do that. I'm thinking about the most powerful football teams in Italy. Juventus, they have like a center, the J Medical, but it's a different thing again. But now that the Milan Football Club have created like something very interesting. I don't have many information about that because I just see what they present in conferences and courses, for example. But yeah, I don't know what you would like to know.
Yeah, no, that's interesting insight into it. So then, for you, then, so after you'd done your sports medicine, when you were starting to do it, like, what was your role? What job did you go into?
Do you mean like after when I completed the residency, or before?
Yeah, just like your first job in terms of when you actually started working.
Okay. Actually, before like getting into the, you know, in Italy you have to do an exam. It's national exam, so every doctors around the nation the same day they do an exam to get into the residency schools. And before that, I used to work in A&D, the worst job I could ever think about it. And I'm joking, but it's a very difficult job, a lot of pressure. The shifts are like, you know, the amount of hours is always the same, but the amount of patients you have to see and all the pressures coming from outside your room. As you can imagine, if I choose like sport medicine, it's because I don't like to work inside a hospital, really. Anyway, after that, I get into the residency school in Modena, where the Ferrari comes from, or Maserati comes from. And during those 4 years in Italy, when you're a sport medicine doctor, you do also mainly actually cardiological screening of athletes, because it's mandatory to, if you want to do competitive sport, you need to see once a year a sport medicine doctor, and you have to get a certificate from the doctor who says, you know, you can perform, you can play your basketball or football, blah blah blah. So I used to work in the sport medicine, like in 8-hour NHS, sport medicine, cardiology screening, child, disabled athletes, also Paralympic athletes, or you know, adults, military, everybody. Prescription of exercising, you know, patients with diabetes, I don't know, or cardiological problems, neurological problems. We used to face like a consequence, long-term consequences of doping, because one of our manager was like, professor was like the head of the doping center in around the area. And apart from that, I used to, you know, still have my contacts with Francesca Della Villa in Isokinetic Bologna, and I was the medical doctor of Modena Football Club, that now is in Serie B, so the second series. I spent 3 years there, and that was like very, very interesting job for me, very, very interesting. And this is where I decided to, you know, to really do more the traumatological part of the and rehabilitation part of the job. Because in Italy, I would say 85% of the sport medicine physicians, they do just the cardiological screenings, not they don't really do the part of like team physicians or federation physician or traumatology or rehabilitation or ultrasound or injections, all these kind of things. And was at the time we won the championship, so it was an amazing experience. After 3 years, we won the championship, so it was amazing. And after that, I wanted something different because when you are a young sport medicine physician, the problem is that you don't have a lot of volume. So usually it's the opposite in medicine. You are a resident and you have like a lot of volume, at least in Italy, a lot of volume. So you have time to learn because of sometimes like just experience and mistakes from your mistakes. Instead, in football, you have 25 patients and not more than that. Maybe, I had also like the academies, but there are a certain amount of patients that have 30% of the injuries are muscle injuries, and other kind of injuries are you always have to treat the same kind of injuries for same people, so you cannot accumulate a lot of information and learn from those experiences. And so I wanted to learn from in a different way, and especially wanted to see what other people in other countries do. So I called Francesco della Villa, Isokinetic Bologna, and I asked, "Can I did the thesis with you in 2014. Can we do again another thesis for the end of my residency? I don't know if you have like places in Bologna or Rimini. That Rimini is like one of the centers close to my house, or in London." And he said to me, "Actually, there is a position open for London. Do you want to try to see to do the interview, blah blah blah." So we did all of that. I did the thesis, and I moved to London in July 2022. 4 months of my last 4 months of my residency, and then I decided to stay here to not just to have the volume and the probability to see many more people or athletes with problems, but also to have like the international experience. Not many colleagues of mine, especially with my specialty, sport medicine, has done that. So I thought it would have been like an interesting experience.
Yeah. So like within Italy then, how big a name is Isokinetic? Like how are they perceived in the sports medicine world?
Is a very big name. Especially in Bologna and in my let's say, I don't know, Italy has like 22 regions that have like the autonomy. Emilia Romagna is where the best food comes from. No, I'm joking. But that is very, very famous. In Bologna, it's like an institution. It's like we have just done like the now the campus is open in Bologna. Isokinetic campus has been opened 1 month ago, or a little bit more. And at the opening ceremony, there were like the mayor, the president of like some institutions in football, the president of Bologna Football Club, the manager. So that they are not just in football, but they are like really a place where people like do athletics, the swimming, I don't know, any kind of sport. They know they can go to recover, to return to sport. So it's quite an institution, and especially in the cities where these centers are, all the people knows about that. So yeah, and after they had time to develop like the word of mouth, because it's been like almost 40 years that it has been open, the clinic. So yeah, it's then you can find there a lot of expertise, when the doctor where we Gianni Nanni was like one of the first doctors. It's where all of us, the youngest one, learn from, for also for to learn is a great opportunity. So yeah, it's also the doctors that they are work for in any center. They are like institutions, not just the centers or the physios, because for example, Antonio Camisari has seen so many athletes, for example, that in Bologna, any kind of, like, from basketball to any kind of sport that you can think about. So a lot of experience. And as I said, it's different when you are in a club or when you are in a situation like in a center. So yeah.
Yeah, and then in terms of that, it's also very famous for the conference that it puts on as well. So I remember when I first got into the industry, which was 18 odd years ago. I remember going to the London one, and it was amazing. Like, with some of the people that were speaking there, and then I was in Madrid earlier on there, and again, just a spectacular event with loads of people, really great atmosphere. So how impactful for you was that when you were coming through the actual education conference?
Yeah, the first conference I've ever attended was the London in 2015. So when you, maybe the following year was even better, but when you go, you see you have a conference in front of like the Big Ben with like the best surgeons in sport medicine of the world, the best sport medicine doctors, doctors from Barcelona, Real Madrid, that they speak, they speak to you and they talk to you, and you can like introduce yourself, so ask them questions. You can talk with like the physio of Chelsea, and it's a lot. I think about these events more because I can talk to people more. If I want to learn, sometimes I learn more from my studies, like the downloading like few articles, and then develop an idea of the pathology and the treatments, and then discuss with more experienced colleagues. So I think the power of like the Isokinetic conference is like the power to put in the same room so many different but in experienced and important people around sport medicine, and that was the goal they achieved. And putting together people from FIFA, ISE, everything, all in everything in the same room, and then the magic happened. And everybody they feel it. I think the following year when I went to the Barcelona stadium, like, was having like I maybe because I'm young, but I've never seen like before that, like a conference, like with like a big screen, like a gigantic screen on the pitch in Barcelona Football Club stadium, where in a moment where in Barcelona they were playing players like Messi, Neymar, blah blah blah, everybody, Busquets, like that was amazing, and that all these kind of small things. So important people, like all the people that they study sport medicine, they at least they read one book, that clinical sport medicine. That you can find the people that has that wrote that book in that conference every time. So it's you can understand why people attend, and they love to attend that event, also to participate, to and to know people.
Yeah, no, I agree. I think the networking piece is so great, and like the one in Madrid was brilliant. And you go and have a few drinks with people, you're talking. There's a great energy around it, and I think that is as important as all of the scientific lectures as well, which is obviously really important as well. And then, so for when you moved to London, then, so how did you find that? What were the differences between being in Italy to London?
Yeah, I love London. Before moving, I've been like maybe 10 times here, and I love London because I think that's my opinion, of course. And I know that maybe sometimes in UK you don't think about England like part of the Europe, but I think it's the only international city in Europe, or at least it's the only city where I felt to be in a metropolis. So I think it's the heart of Europe, and and it's also a different culture, from the other European countries. When I go to Spain, it seems like as it seems like Italy every time, and with so few differences. Instead, here you feel like here is where I feel to be abroad, and so I love the city. The pros and cons, of course, because it's big to get. I live like maybe 60 kilometers from the clinic, and to get there in my country would have been like 5 minutes by car. Is like 40 using the public transports, because you cannot get there with your apart from if you use like a motorbike, you cannot get there with a car if you don't want to spend like a lot of money and time, to be honest. And so I would say that the quality of life is it's a little bit lower compared to Italy, because of this. However, it is somewhere you want to be if you want to do, is where the things happens. So it's as I said, yeah, I like it because it's like I feel it's the center of the of Europe. So where all the things happens, where you can build very strong connections with like people that they do sport medicine at the top, where you can find there's no other place I think in the world where you can find 7 top clubs in the same city, or even more if we take into account the others. I'm talking just about football, but there are other sports. Nobody maybe talks about it, but there's like a very good basketball team in Stratford. So yeah. Anyway, this is what I think of London is the center of the world. Then you have to take into account that it's very expensive, and the commute it's not ideal, let's say.
Yeah, and then like for the culture at Isokinetic, like what is the culture like within the organization? Because I know a lot of the team. I know Andrea well. I know some of the other guys on the rehab side. But what's it like, the culture there?
The culture is always to put the patient first. Then it's all around like because I think the culture is about like giving a good quality of diagnostic and treatment to the patient, and also create an environment where the patient can feel treated well, and where you can find enthusiasm to recover, because sometimes it's always even if like, a ligament injury. It's not like a, a dangerous disease, life-threatening disease. But if you want to compete, if you want to return to sport, it's something that could affect not just your knee or your hip, but also your mind. So the environment where when you do your rehab, it's very important. It's very important to feel that not bored, to feel an environment where you have like stimulus from your physios, your doctors, the reception. You can use like different environments to recover, and you feel that you're making a good job. So the culture is like putting the patient first, let him understand, giving goals if he's like doing well or not, and giving to him enthusiasm
Yeah.
to put him in a position to recover what he can or she can.
Yeah. Well, what do you think are like the important non-clinical skills to be an effective clinician?
I think could be even like 80%. Maybe sometimes it's even more important than the actual diagnosis or and treatment, because there's also the placebo part of the treatment, and if you in a long process, especially if we talk about ACLs, for example, everybody talks about like 6 months, 7 months, but the reality is like if you are like a amateur athlete, it's much more than that, for example, and because you have to work meanwhile, so you cannot do a double session every day for 6 days a week. So it's a long time to recover before, and usually athletes they have like they have like a certain amount of endorphin from doing sport. They in a certain now they can, the following day they cannot. So it's like you fall in a depressing mood, and so giving also the empathize with the patient and trying to not just to give the treatment but also to talk about the situation, and it's a very important part of the job of a physio, of a doctor. But in an isokinetic environment, also from the reception starts the treatment.
Yeah. No, I definitely can see that plays a massive part in it. And in terms of like the impact, like you've mentioned Francesco a couple of times there. So like what how do you find working with him? And you hear his name talked about. I've never met him personally, but you've heard of him mentioned a lot.
Yeah, I met Francesco in 2014. He was like a resident doctor at the time, and I respect him so much. I've never seen someone work as hard as he can, as he does, in isokinetic. So just to give you an example, when you have to do your residency, so you have to go to the hospital and then do your shift. When you finish this shift, you went to the clinic to continue to work till I don't know 8, 9, 10, I don't know. And I started work with him like in 2014. I collected them. They did like the 1001 ACL study, so collecting information about 1,000 patients that has suffered ACL injuries, and I did the follow up after 2 years, so to understand what were the risk factors of the second ACL injuries, and polling like around 250 patients. So my relationship with him was more research side, at the beginning, because he is the head, of course, of the education and research department, and is a very dedicated doctor, and he knows how to manage the part of the research, but also there's more than that. It's not just a scientist, let's say. Then at the end, it became like more my director, and when I become like a real isokinetic doctor 2 years ago, and it's the guy I call when I need something. So yeah, I texted him yesterday, for example.
I won't ask what you asked him, but anyway, we can. That's a private thing. But so, what would your advice be to people looking to get into, whether it's sports medicine, physio, what into this area? What would your advice be?
That's a good question. My advice is because the first advice is to take into account pros and cons. So, and really understand what's the job, because sometimes the people they choose, like, for example, I can say, like, as a doctor, I want to be like the doctor of like a Premier League club, and you don't really understand what's really the job. So then you have to, what I would suggest is to, if you have an opportunity to, before to doing this job, to just talk to someone has been doing that job for at least 5 or 10 years, just because you can hear from them what's the pros and cons, and that have an idea. Then you can decide that if like me, you have like as a job medicine, be a doctor. You like sport and the environment. Could be the same for a physio or for a sport therapist, whatever. But it's always a job. Even if it's your passion, medicine or sport, it's always a job. So you have to take into account, the money, the how many days you have to work a week, how many hours you have to work a week. If you have to get up at 6 o'clock in the morning, like I do, for example, and get back to home at 9, like I do some days, or you don't like that. Some colleagues of mine, they said, I could never do what you do, or what you have done when you were like a team doctor. So it depends on. I would suggest that to talk to people that has done like 5 or 10 years the job they want to do.
Yeah, no, that's good advice. That's good advice. And then lastly, who's your favorite Italian football player of all time?
All time, I'm a Inter Football Club fan, so it's Ronaldo is phenomenal. I have like a T-shirt at home. When Inter Football Club has like Umbro, like as a T-shirt, so that's big. That was amazing to see him play. Now, if I have to talk about now, the player I like the most, it's Bastoni instead. But at the time, that in general, Ronaldo. So by far, so it's unbeatable, I think, for me as a fan.
Well, I remember they signed Ronaldo and Recoba at the same time, didn't they? And I remember on the debut for both of them, Recoba scored 2 incredible goals. Like
Recoba was amazing. I think he used to play for Vicenza. I don't remember, like a small team. I don't remember anyway. That so underrated that player. I think his foot was like just magic.
Yeah, but when Ronaldo is, it was just absolutely insane. Just a shame about the injuries.
Yeah, apart from his patellar tendon, and there's also I know that for a player, they are human like we are. So I cannot imagine coming from because I had players from Brazil from the same background, and when you hit 18, you move to Europe and you become like an idol. A lot of money, all the all all the things you want to do, you can do it. You can afford. Maybe you don't pay for everything for anything. So I can understand why maybe you started like clubbing a little bit more, going out a little bit more, and because it was pure talent. It's the opposite of actually the new Ronaldo, no? So it's more talent and less work.
Yeah. Yeah, no, it's interesting. Yeah, do you think that could have been? So, do you think if he was around now, so 25 years later, or 20 years later, do you think it would be different?
Maybe now, considering that there are like all the social networks, everybody has a camera on their hand. Players, if they want to, they party anyway. But it's more difficult, I would think. It's more difficult. But yeah, so probably could have been different. But it was amazing to see him play. I don't care. Like for Adriano, so it was the same. So that was amazing to see. I don't care. It happens. It's okay. I wouldn't say it's a waste. A waste would have been like not seeing these players play.
Yeah, well, he won 2 World Cups, so it's still pretty good that he was able to do it. Yeah, brilliant. Look, Alberto, really appreciate your time. Thank you for sharing, and yeah, really appreciate it. And I'll look forward to seeing you soon.
Thank you. I'll see you soon then.
Thank you very much.